As we have seen in several cases this week, the H1N1 virus is still very much a concern in New Mexico. And joining us this morning again is Dr. Naomi Kistin, Regional Health Officer for the state of New Mexico. Dr. Kistin, thanks so much for being with us on short notice again today. Now, there was a big meeting yesterday in Bernalillo County in Albuquerque with the state health department, but also with various organizations in the state, basically trying to get on the same page, or in the county rather, trying to get on the same page. Exactly.
It was very encouraging. There were over 200 people who came to this meeting from multiple sectors working in Bernalillo County. And the exciting thing was that, number one, a lot of work is already going on, but people committed to doing all they can where they are and in coordination with each other to try to do as much prevention and vaccination of people in Bernalillo County who are priority groups. So even though we do have some H1N1 in the community, people feel that there's still an opportunity to do a lot of prevention and vaccination.
Well, it's good to see everybody working together on this to get on the same page. And one of the things that's been discussed is, where do you inoculate people when the swine flu or H1N1 vaccine gets in? And there's talk of possibly doing this at schools. Is that correct?
Right. There are several plans for different scenarios. How much vaccine we have initially will affect how many people we can vaccinate, and we want to make sure that the most vulnerable people get the vaccine first. We'll be following CDC guidelines on how to manage that vaccine, but definitely one of the scenarios is that vaccines will be given in schools. At this point, there's a great school flu project for seasonal influenza, which happens every year, but this project has already set up a model for immunizing in schools and is very successful. So one possibility is that we would use that same model for H1N1 vaccine.
Now, there is also talk now that perhaps those who will be tested for the swine flu H1N1 virus will only be tested if they are hospitalized. Where is that possible procedure at?
I think the question about testing is an interesting one. At this point, because we know there's H1N1 with us already, what we're looking for most importantly is whether there's any difference in severity of the disease compared to regular flu. At this point, it looks a lot like regular flu, and as people know, we don't normally test every single person to confirm they have flu. We look at the symptoms and manage it the way we always do.
Well, there are a lot of flu cases up in Los Alamos, up in Kirtland we've heard about, of course, the one swine flu verification here in Albuquerque. It seems a little bit early for the regular swine flu, if you want to call it that, or regular flu rather, this time of the year. Is that an accurate statement?
That is accurate. There are some differences with this virus, and one of them is that it was with us all summer. So we did expect to see more cases when kids came back to school, because where people gather, it's easy to spread flu.
Right.
So that's a difference, but it's not more severe yet.
And it looks...
For example, the student in Albuquerque that you mentioned is already better and had a fairly typical flu course.
Oh, that's good news there. Good news. And the flu vaccine is still expected sometime in October. Dr. Kistin, thank you so much for visiting with us and updating us. We really appreciate it.